Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over skin fold management and also going over moisture and how to deal with that. But first, if you could hit that subscribe button, it would be greatly appreciated as it does help my channel reach more people. So let's get started, guys. So patients with a high degree of adipose tissue, okay, so adipose tissue is fat tissues, fat cells, they're more at risk for inflammatory conditions. And unfortunately, the number of these patients do continue to rise. So increased adipose tissue may impact daily living, continence, and overall quality of life, among with other complications. So abdominal obesity may be associated with incontinence, mechanical and neurologic changes, so chronic strain or weakness of the nerves in the pelvic region, and skin fold inflammation or irritation, and that's exactly what we're going to be talking about today. So when it comes to skin fold management, skin health and skin hygiene is the initial steps, okay? So an individualized plan of care is super important because not everybody's skin reacts the same. Some people can tolerate creams and lotions, others may not. Additionally, any powders, they may accumulate in the skin folds and become abrasive or difficult to clean, especially out of deeper skin folds, okay? It's super important to use a pH balance cleanser and pat the skin dry, okay? So we want to lift the fold and pat it dry, okay? I say pat it dry. We want to dry it very, very well, but very gently, okay? Sometimes the skin, when you're wiping it too hard, the skin just kind of comes off because it is a damp area for the most part. So we want to make sure we're very cautious with that skin and we're not causing friction injuries to that area, okay? Lifting or repositioning equipment, it may be helpful, or just having another set of hands. So a lot of times when we have very big patients who are really struggling to cleanse themselves, we will get a PSW in to help them do this. So moisture associated skin damage. So it is a general term for inflamed skin related to prolonged moisture. Okay, so the moisture can be from urine, stool, sweat, wound drainage, etc. Okay, guys. Now, it is kind of an umbrella term for two different conditions. So intertriginous dermatitis and incontinence associated dermatitis. They both have to be treated and managed differently, okay? So we will start off with intertriginous dermatitis, so ID or ITD for short. So it's often seen in deeper skin folds, okay? If skin folds are not cleaned and dried properly, maceration and skin irritation may develop, which leads to a viral, bacterial, or fungal growth, okay? Often resulting in a foul odor, which may contribute to a decreased quality of life. They may socially isolate or even feel hopeless, okay? It's embarrassing to smell. So we really do need to take this very seriously. Developing an evidence-based, individualized care plan for each patient is critical, not only for skin health, but overall quality of life. Absorbent clothing. So absorbent clothing or wicking material are helpful in skin fold management. I did put Interdry here. That's something that we use, but there are different materials. So after cleansing and drying with regular skin assessments conducted at least daily, extra care should be taken to make sure that layers of clothing between the skin folds are not adding extra pressure, which could result in device-related pressure injuries, okay? So we're already dealing with the skin folds. We want to make sure what we're using inside of them aren't creating pressure there, and then having an injury because of that. So then it would cause an open wound. Okay, the material should extend out about 2 to 3 inches, and that will help wick away moisture. And it should be changed at regular intervals. It'll say on the manufacturer's recommendations. Without treatment or follow up, this can turn into cellulitis, and it can also turn into more significant medical problems. Okay. Okay. So next we have incontinence associated dermatitis. So obviously, as the name suggests, this is moisture associated to either stool or urinary incontinence. It typically requires treatment and prevention methods beyond basic skincare or hygiene. Moisture barrier ointments and cleansing cloths designed for management or cleansing during incontinence care are often recommended. Moisture barriers ointments are typically applied after each incontinence episode, okay, to maintain skin integrity. So it's often recommended that you don't actually remove all the ointment. So what you do is you just wipe across it, making sure that there's no urine or fecal matter in the ointment, and then just reapply the ointment. In addition to protecting the skin, we must also offload, look at additional risk factors, complete a head-to-toe assessment, and take into account any additional comorbidities, conditions that may delay wound healing. So Skinfold management, it is a critical element of care for all patients, especially for those with increased adipose tissue. Skinfolds, normally irritation is caused by moisture and may be related to ITD and IAD. So it is important to start a strict hygiene routine and keeping those areas clean and dry, because like I always love to say, prevention over cure. Cure is so much more difficult than prevention. To prevent any further complications is so much easier than to actually cure them, because we have to go back to the prevention methods plus adding other methods too. So it's just easier to do the preventative measures, and then we don't have these complications. Making sure that the patient has evidence-based practice, has an interdisciplinary team approach are essential components for a holistic approach for this patient, to really provide the best outcomes that we can. So I hope this video, it did give you a better idea of Skinfold management and really how to take care of the moisture. And it's just really talking to your doctors, making sure you have a team, making sure you have things in order to prevent any damage, making sure that you're clean, or if we're taking care of someone, that we're really cleaning and drying out those areas. But once again, that's all I have for this video, guys. I hope to catch you in my next one. Bye for now.